weight loss medicines actually safe to use, and do they even work? Those are questions a lot of people are asking right now, and the honest answer is it depends entirely on which treatment you're talking about and how it's being used. Before we dive in, this video is general information only, not medical advice. Always speak to your GP or pharmacist for personalised guidance. In the UK, there are several licensed weight loss medicines available, and the evidence behind them is quite different from the unregulated products you might come across online. So let's break it down properly. Licensed weight loss medicines are not designed to do all the work on their own. They're meant to support a structured program that includes changes to your diet, increased physical activity, and behavioural support. They're an addition to those lifestyle changes, not a replacement for them. The medicines currently licensed in the UK include Orlistat, which you might know under the brand names Xenical or Ali. There's also semaglutide, branded as Wegovy, and this is particularly significant right now because an oral version has recently become the first oral GLP-1 medicine licensed in the UK for weight management. That's a notable development. Other licensed options include tirzepatide, known as Mounjaro, liraglutide under the brand Saxenda, and a combination medicine called naltrexone and bupropion, or Mysimba. These treatments work in different ways. Some act on the brain to reduce appetite by influencing the signals involved in hunger and fullness. Others work in the gut. Orlistat, for example, reduces how much dietary fat your body absorbs. Then there are the GLP-1 receptor agonists, like semaglutide and liraglutide, which mimic gut hormones that help regulate both insulin and appetite. When it comes to who these medicines are suitable for, eligibility is based on specific criteria, including your BMI and whether you have certain health conditions alongside your weight. NICE recommends Orlistat within standard NHS pathways, while the newer injectable and oral GLP-1 agents are generally only available within specialist weight management services and only for people who meet particular clinical thresholds. This is why a conversation with your doctor is so important. They can assess whether any of these options are appropriate for you personally. Dosing and monitoring are always directed by your prescribing clinician or pharmacist. It's also worth knowing that all licensed weight loss medicines should be avoided during pregnancy and breastfeeding. If you're of childbearing age, effective contraception is recommended during treatment. On the subject of side effects, the most commonly reported ones are gastrointestinal, things like nausea, changes in bowel habits, or stomach discomfort. These are generally more common when starting treatment and can settle over time. There are also rarer but more serious risks to be aware of. With GLP-1 receptor agonists in particular, research suggests a small risk of pancreatitis, gallbladder disease, and acute kidney injury. These are uncommon, but they're exactly why medical supervision matters. If you experience severe or persistent abdominal pain, signs of an allergic reaction, or any symptoms that concern you after starting a weight loss medicine, contact your doctor promptly. For urgent advice, call NHS 111 or 999 in an emergency. And please, if you're considering anything purchased online that isn't from a regulated pharmacy or prescriber, be very cautious. Unregulated weight loss products sold online have been linked to undisclosed harmful ingredients, cardiac arrhythmias, liver damage, and in some cases, death. Always use legitimate regulated channels and speak to a healthcare professional before starting any weight loss treatment. So to recap, licensed weight loss medicines can offer real clinical benefits when prescribed appropriately, under supervision, and as part of a broader lifestyle program, but they're not suitable for everyone, and they're not without risks. The new oral GLP-1 option is worth asking your doctor about if you're interested, and anything unregulated carries dangers that simply aren't worth taking. Have you spoken to your GP about weight management options? Drop your questions in the comments. We'd love to hear from you. If you found this helpful, please give it a like and subscribe to the Bolt Pharmacy channel for more medically reviewed health information.